All right, so continuing on with the complex medical nutrition therapy for the renal diet. Again, protein for someone not on dialysis, the needs would be 0.6 grams per kilogram of body weight. For a patient that is on dialysis, we're going to see about a 1.5 grams per kilogram of body weight because higher protein needs related to that treatment of using both hemodialysis or peritoneal dialysis. We also want to look at quality of life because, as you can see here, these nutrients, protein, sodium, potassium, phosphorus, fluids, that's a huge chunk of food groups that are vital for a healthy diet. For instance, protein, obviously our protein foods, dairy, fish, nuts, seeds, sodium, processed packaged foods, potassium, oranges, bananas, melons, peppers, and then phosphorus, dairy products, chocolate, coffee, tea, and then fluids. So if someone has very mild kidney failure, if they're very old, we might not want to implement these very aggressive guidelines. Okay. The goals of the renal diet you'll find in your text, I believe on page 117. And you'll also see some information with nutrition recommendations for both hemodialysis patients and chronic kidney disease patients that are not having dialysis. One of the things that I want to have you make sure that you become familiar with, especially for today's homework, is looking at this and saving this handout here. This is on determining fluid needs of adults. And I'm going to pull that up on our screen so we can look at it together. All right, so you'll see this in both your homework and then also by the Chapter 5 PowerPoint on Blackboard. So you already know that normal fluid needs for adults are 25 to 30 milliliters of fluid per kilogram of actual body weight, okay? If someone needs decreased fluids, it's typically related to congestive heart failure and COPD or chronic obstructive pulmonary disease. We'll talk about both those conditions in Chapter 6. Someone who has edema, which is a fluid, holding onto fluid, fluid overload, hepatic failure, or remember that's liver failure with ascites, renal failure, third spacing of fluids, and someone with significant hypertension. Okay. Contrast that with someone who needs increased fluids, and that's someone who has constipation, dehydration, diarrhea, fever, vomiting, a fistula. Remember, that is a artificial opening from one organ to another or draining wounds. Hot or dry environment, diuretic use, like the medication furosemide, which is typically referred to as a water pill. Low blood pressure, polyuria, a symptom of uncontrolled diabetes, which we'll also learn about in Chapter 6. And then use of an air fluidized mattress, that would be someone who has significant pressure ulcers or sores related to not moving, changing positions. So it's typically seen in someone who's morbidly obese or someone who has quadriplegia, paraplegia, where they're unable to get in and out of bed on their own. So this handout you will want to save and use for both homework for this week and then in upcoming assessments. All right, so that is renal diet. I did want to highlight one more piece, and that is potassium and sodium. So you're very familiar with foods that are high in sodium. Potassium, oftentimes people will turn to a no salt or a low salt or salt substitute when they're on a renal diet, thinking that they're helping themselves because they're getting less sodium. But recall that sodium is sodium chloride, NaCl, and the salt substitutes are potassium chloride, KCl. And if a patient is using excessive amounts of salt substitutes or the potassium